As Africa moves forward with its ambition for sustainable economic growth, there is a growing realization that the goals envisioned in Agenda 2063, Africa's development framework, can only be achieved if the investments in human capacity are also underpinned by investment in the health and well-being of African citizens through the development of a robust public health sector. Moreover, given that the continent faces specific and priority diseases of concern, there has been an urgent and growing need for an African-driven approach to addressing issues of public health concern, focusing on capacity building and investment in public health institutions, advocating for universal health coverage and provision of primary health care services, investment in research by African scientists and preservation of their intellectual property, improved surveillance, prevention, control and intervention, as well as investment in local pharmaceutical manufacturing within African Union member states. And with Africa's significant youth demographic, the investment in healthy and productive populations is even more urgent to ensure lifelong contribution and sustainable economic activity, such as access to adequate public health institutions and health interventions. The call for a technically strong and credible voice in public health care for Africa was answered in 2016, when the 26th Ordinary Assembly of Heads of State and Government agreed to establish the Africa Center for Disease Control and Prevention, Africa CDC.
Africa CDC was created in 2017, and it was a specialized technical entity for African Union, just mostly for outbreak response. And it was a small secretariat, a small entity that was supporting African Union and member state.
Africa CDC was launched with the goal of supporting member states in their efforts to strengthen health systems and is equipped with the medical oversight, expertise, and the ability to leverage its strengths to address the continent's pressing healthcare needs. Africa CDC is a demonstration of finding African solutions to African problems and squarely positioning itself as the leading voice on Africa's public health matters.
The Africa CDC conversation started way back in probably 2010, 2011. The continent has been experiencing multiple outbreaks in the DRC for Ebola. And the Africa Union felt it was not part of the planning for an actual response. So way back before we had any really big outbreak on the continent, that conversation started mostly at technical level. Africa CDC's work requires that if there's an outbreak today, we are responding today. So this challenge of being able to make decisions was tabled to them. And their decision was Africa CDC must be able to work outside of the constraints of a political and policy institution like the Africa Union. That is how we came to be granted the autonomy in February of last year.
Agenda 2063 recognizes health as a cornerstone to achieving development across the continent, with a decree that adequate levels of investment are made to expand access to quality health care services for all people.
The African Union has launched what they call the Agenda 2063, and healthcare is a prominent goal for the agenda. And credit must be given to the African Union because they have since established the Africa Centers for Disease Control and Prevention, which was accelerated. In 2017 is launched because of the Ebola outbreak in West Africa. They have also now launched the African Medicine Agency, commonly called AMA, which is so important to ensure that the quality of the products, the medical products that enter the continent or are produced in the continent actually meet the appropriate standards. And that is a serious consideration and an important health security component there. You also are aware of the Continental Free Trade Agreement with the headquarters in Accra. So all of these instruments are beginning to come together as systems and institutions that collectively can enhance the health outcomes and impact in Africa.
The COVID-19 pandemic exposed the lack of investment in Africa's national health systems and the need for a paradigm shift that goes beyond pandemic times. Strengthening national health systems in Africa is a critical goal of the Africa CDC. It has carried out training and capacity building initiatives throughout the continent with the aim of harmonizing policies and systems and building the capacity of national public health institutions. Moreover, Africa's CDC's strategy has a long-term approach, which is to facilitate research and academic institutions to strengthen scientific study, while building a robust workforce that can implement sound public health policies and strategies for the continent. The strategy is underpinned by a new public health order for Africa, a structured framework for public health engagement in Africa that is defined by 5 key pillars: stronger public health institutions, a strengthened public health workforce, expanded local manufacturing, increased domestic resources for health, and action-orientated, respectful partnerships.
The model we are putting in place following the vision of new public health order. We don't want people flying from Addis every day to support country, but we want first to have at country level experts, at regional level who can support country levels, and then we can also have colleagues at HQ level going to support.
The new public health order is really a consequence of the inadequacies of the existing structures globally that address health security, particularly here in Africa. When we faced large outbreaks before, including the West Africa Ebola outbreak, the multiple outbreaks of Ebola in the DRC, the multiple outbreaks of cholera, measles, even polio on the continent, the response has been largely led by institutions that are not African. And the way that the response had been structured then was based on their understanding of the continent, not on the priorities and understanding of Africans to their needs. Let me also add that it is not just a vision. This is our reality, and we are already implementing all the 5 pillars within Africa CDC, within our member states, and we are persuading other institutions working on the continent to also follow exactly the same vision, so that in Africa we are doing things under one umbrella, the vision of a new public health order.
In order to ensure Africa CDC's capacity for rapid responses in continental health emergencies, 5 regional coordinating centers have been established by Africa CDC to support surveillance, laboratory systems and networks, emergency preparedness and responses, further strengthening health capacity and development in AU member states. These regional coordinating centers now play a critical role in bringing public health initiatives and resources closer to those that need them, while strengthening health security in partnership with national public health institutions.
The role of the Africa Regional Coordinating Center is very critical and essential. One is the core component of the Regional Coordinating Center that give Africa CDC the strength is our ability to engage directly with a member state. And that engagement, it does matter because it builds trust. It also builds to better understand what the Africa CDC is doing. So it makes it easy that our ABS can be able to contact the team at the any ministry, share with them the information, if there is an alert in real time. And that helps that Africa CDC provide a quick response to do the investigation, identify what is the issue, and a proper response is being done.
Each RCC has what we call an eco platform, where all the member states within that region They meet on a very regular basis, some every week, to share that now we have had 10 signals from this country. We have investigated the signals. Only one was really relevant, and we have resolved it. So our regional coordinating centers are extremely important in ensuring that early warning system, the collaboration across borders, and a regional response is designed around any big health emergency that may occur within their own jurisdictions.
The COVID-19 pandemic dramatically exposed the fault lines globally in public health systems, including those on the African continent, and demonstrated the necessity for interventions that will improve and strengthen African health systems at local, national, and regional levels to withstand future emergencies.
When the COVID started, Africa was abandoned. We saw other countries, Western countries and other continents, keeping for themselves vaccines and other products that they had to fight COVID. You can imagine how stressful was this situation for Africans. But we want now to say, okay, maybe this is not the last pandemic. Maybe we can have others. How can we ensure that if this one happens again, we are protected? This is why we are launching this initiative that we call PFVM. It means to manufacture vaccines and other commodities in Africa.
Many people predicted that the numbers will be huge in Africa and people will be dying in Africa in large numbers. I'm glad that we proved them wrong, because we just put in place proper public health principles, and that's how the numbers remain low.
I believe the number one lesson that was learned during the COVID pandemic in Africa was the power of cooperation and coordination by the Africa Union, underpinned by the Africa Centers for Disease Control and Prevention. The young organization was challenged in a tremendous way, but because of the strong political support, the strong ability to coordinate across all 55 member states, the young institution actually proved its worth. And it showed for the first time that a centralized body, disease control agency in Africa, could be so determinant in helping a continent of 1.4 billion people to fight a rapidly evolving respiratory infectious disease.
Throughout our response, we learned lessons. The first is the need for coordination at the top leadership level. And here I mean our heads of states, and by delegation, the ministers. At the beginning of the pandemic, we had in excess of probably $80 million being raised from within the continent. Private sector, intergovernmental institutions, even the public participated in contributing so that Africa CDC could actually do the response that was required. So this is one very important thing, coordination at the highest levels, because that then gives you speed, it gives you resources. The second lesson we learned is you must manufacture what you're using for your response. It was frustrating in the beginning. We could not get diagnostics. And if you cannot get diagnostics, you can't know what your burden of disease is. Third lesson we learned is you must respond early and quickly. And responding early is taking decisive action and ensuring that the health workers are well equipped and protected to be able to do the work which they're supposed to do. But then we use the same lessons. When the Ebola came in Uganda, we used them. In DRC, we use the same lessons. Marburg virus disease in Equatorial Guinea and Tanzania, we're using the same lessons. Cholera in largely Malawi, but also Mozambique, Zambia, and the Southern Africa belt, we use the same lessons. And we controlled all these outbreaks in record time. So we are putting into action the lessons that we learned during the pandemic.
The emergency response status of Africa CDC is also underscored by its position as the leading public health agency for the continent that is now working in sync with its partners to challenge endemic imbalances in the wider global health system. This is being achieved by cooperation through partnerships with African development institutions, global health organizations, philanthropy, and the private sector.
Really exciting moments to be discussing health systems on the continent, institutions on the continent, and very importantly, in partnership with the World Health Organization. The World Health Organization this year is celebrating 75 years of its existence. It's a landmark. Remarkable progress has been achieved in disease control on the continent, but the continent still faces tremendous challenges. So strengthening those institutions and systems becomes a priority, I believe, for the continent. And the right leadership is in place. Our people like President Kagame is leading an agenda for domestic financing. Our President Ramaphosa is leading the COVID Commission for Africa, and other presidents are championing other causes. That is just the right thing to do at this critical point.
Africa CDC is a very critical institution for the continent. And for us, we've worked with the Africa CDC a great deal, especially during the run-up at the time of the pandemic. With Africa CDC and other partners, we put in place the Africa Medical Supplies Platform, which was a world-acclaimed digital platform that was used to procure COVID-19 materials. We were able to work with Africa CDC, UNECE and all that, to again structure an innovative scheme that made it possible for the continent of Africa to acquire 400 million doses of Johnson & Johnson COVID-19 vaccines. Afrexim Bank guaranteed this in an amount of $2 billion. We've seen that when such crises occur of the nature we saw with the COVID-19 pandemic, that every part of the world look after themselves first. We have to look after ourselves. So we at Afrexim Bank see the Africa CDC as a strong partner in making sure that no African country, no African is left behind whenever we confront a health crisis.
As two major public health institutions on the Africa continent, the World Health Organization and Africa CDC have come together over the past few months to develop a 5-year joint emergency preparedness and response action plan. This joint action plan was launched at the World Health Assembly in May of this year. And finally, we have established a steering committee meeting. They meet on a quarterly basis to ensure that this strong collaboration prevails.
GIZ has been a long-standing and trusted partner of the African Union since 2004. And we have also been supporting the African Union in the field of health. Since the beginning of the Africa CDC, we have had a joint project called Strengthening Crisis and Pandemic Response in Africa. And in the context of this project, we have supported the Africa CDC as a quite young organization in institutional development, in also improving the management capacities of Africa CDC, but also in the field of partnerships management. And the overall purpose of this cooperation is, of course, to strengthen the resilience and health security of Africans across the continent.
What we have been trying and aiming at in our cooperation between the European Union and the Africa CDC is to have what we call a 360-degree approach, which means that we're really trying to go around the whole issue and see what needs to be done. When I said the 360-degree approach, so you see there is institution to institution, there is the whole issue of the diagnostics, there is the whole issue also of deploying health workers, and then there is also the issue of actually vaccine productions. So we will actually, as European Union, have ended up providing 1.1 billion euro to the whole 360-degree approach.
In addition to cooperative efforts with its partners, Africa CDC is critical in supporting the improvement of regulatory harmonization of medicines for priority diseases. And with the establishing of the African Medicines Agency, a specialized agency of the African Union, the goal is to enhance the capacity of AU member states to regulate pharmaceuticals in order to improve access to safe, quality, and efficacious medicines for all. This will in turn boost pharmaceutical production on the continent and increasing cost effectiveness of medicines through enabling pooled procurement for enhanced medical supplies. This interagency collaboration is also underpinned by the African Union's Pharmaceutical Manufacturing Plan for Africa, which was established to develop the African pharmaceutical industry as a sector with a projected value of over $40 billion by the next decade, and which will contribute significantly to economic growth, as well as the considerable reduction of burden of disease in Africa.
We are very well aligned with the Africa Medicines Agency, which is now the new institution of the Africa Union that are going to be responsible for regulating these health products. So when we are saying we do local manufacturing, we are going to do gold standard manufacturing of health products, and the Africa Medicines Agency is going to be responsible for ensuring that that gold standard is maintained and any product that is being manufactured on the continent and having access to the AFCFTA network of economic possibilities, it is good quality health products.
Through collaboration, Africa CDC is able to anchor its public health order initiative with wholly African ownership of continental health challenges, thus promising better outcome for the continent's citizens through increased access to equitable health mechanisms such as enhanced technical assistance and funding for scientific research in crucial areas such as pathogen genomic sequencing and fighting antimicrobial resistance.
One of the key challenges at the continental level is also the balancing the access to essential medicines. We argue that yes, indeed, antimicrobial resistance is driven by overuse or misuse of antimicrobials. But we also know that on the continent, we face challenges with substandard, falsified antimicrobials. We know that several areas within the continent don't have access to these essential antimicrobials. And so Africa CDC really prioritized really addressing those gaps around access to essential antimicrobials, essential diagnostics as well, because diagnostics is quite critical for testing. In February 2020, through the leadership of Africa CDC, as well as the members of the African Union Task Force on AMR, we were able to lead a continental push, a political move by the AU heads of state and government, and this is the African Common Position on Antimicrobial Resistance.
Human resource deficiencies, inadequate infrastructure, and health funding gaps are among the most challenging issues facing the African public health sector today. Africa CDC is geared to play an important role in all these challenges, promoting national ownership and building the capacity of AU member states' own public health institutions. Moreover, Africa CDC is now pioneering new strategies and innovations, including convergence between public health and advancements in technology, such as synchronizing public health data as part of a new digital transformation strategy. This will enable countries to enhance data on clinical trials, improve immunization registries, and enhance diagnostics between laboratories for real-time data. A new and improved future of modern public health analysis and intervention is now being forged and envisioned by Africa CDC.
Our vision is that when an outbreak occurs in any part of Africa, the central government of that country must know within 6 hours, and Africa CDC must know within 24 hours. So we are very focused on ensuring that we use the whole digital space appropriately to strengthen our work, to improve our speed, and to ensure that the data that we are getting is real-time. We analyze and we are able to design a response that is going to target exactly what is required at community level.
It's really a huge misunderstanding if other continents can think that they will be safe by not supporting Africa also to be safe. We have to work hard to strengthen the health system in Africa. We need to work hard to have an African continent becoming resilient. I think if we have a combination of that, you will see Africa tomorrow will be different, and health sector is the entry point for the development of a country. When you don't have health people, you can't dream to have development. This is why we are sensitizing our leaders, and we are using this vehicle that is Africa CDC, working closely with other organs and the AU Commission with other partners to see where we are bringing our Africa that we love too much.
Everyone should continue to support the Africa CDC to rise to the next level. It has a new leadership that we are all encouraging, supporting, to move the agenda forward in key areas like decentralized manufacturing of health security commodities, i.e. diagnostics, vaccines, therapeutics, workforce development, in the areas of networking across the continent. It's a vast continent of 1.4 billion people. So how do you network institutions, universities, so that you can harness the assets that exist within the continent in the areas of disease surveillance and laboratories, and of course a partnership with the private sector. So those are key areas and priority areas the continent can continue to lead under the guidance and direction of the Africa Centers for Disease Control and Prevention.
Every outbreak starts at the community. Every outbreak ends at the community. Our community is our member states. So Africa CDC is working to strengthen national level institutions that are responsible for public health. There's a lot going on globally. The success of Africa CDC in the next 5-10 years is to positively influence all those conversations on behalf of the continent, so that every discussion that is beginning, Africa is on the table, Africa CDC is on the table. Our priorities, our interests are part of that conversation from the word go.